Okay, why don't we go ahead and get started? Thank you all for joining. I'm Tom Harmon. I'm the External Affairs Director for Together for Health. I'd like to welcome you to our webinar on our Cervical Cancer Grants Program, which just launched its fifth ever request for proposals. The purpose of this webinar is to provide a brief introduction to the grants program, explain some of the changes we've made this time around, give a brief overview of the updated evaluation criteria, and provide an opportunity for any questions before the end of the webinar. Before we do get started, I just wanted to say that this is one of our major projects at Together, and it is something we look forward to every year. We're consistently inspired by the breadth and depth of proposals and by the creativity and the dedication of the global cervical cancer prevention community. So thank you all of you for being a huge part of this incredible global goal. Next slide, please. Just some brief information on the history of the grants program. We launched our first RFP in 2019 with the goal of identifying programs we felt could innovate and scale successful cervical cancer prevention strategies in low and middle income countries. We updated our approach in 2021 to focus on two tracks, one for programs seeking to increase demand for cervical cancer prevention and one to address supply constraints. For some more concrete examples of these, please see the RFP. To date, we've granted $300,000 across 11 proposals for programs active in 9 countries and across 3 continents. The first several RFPs garnered around 50 or 60 proposals per year. Last year, however, we saw an absolute explosion in the number of applications to a total of 226, sorry. That prompted some changes in our approach for the 2025-2026 cycle. Our new process utilizes a web-based grants portal. We think this is going to make the application process more consistent and more concise for interested organizations. We've also aimed to be a little bit more transparent about our evaluation criteria going in. Next slide. I wanted to make a few notes on the timeline. As you can see, a few of these dates have already come and gone, and we're currently in the webinar listed. All applications are due by 6 p.m. U.S. Eastern Time on Friday, May 30th, no exceptions. Awardees will be notified in July and will undergo a review pending formal approval, and we're going to announce the winning proposals in early August. Just FYI, the grant period is 1 year. Next slide. Our review process is broken into 3 parts. First, we do an initial review to ensure that each proposal meets basic requirements. Projects must be based in a low or middle income country based on World Bank criteria. Applicants must be certified not-for-profits with a demonstrated track record in cervical cancer prevention programming, and projects must demonstrate cost sharing from other sources. Projects that meet those initial criteria are then reviewed by the Together team based on the evaluation criteria listed in the RFP. We'll get back to those in a bit. The top 5 scores from each track move on to the final review phase. Final decisions on awardees are made by a combination of our staff and invited external reviewers using the same evaluation criteria. Next slide. I'm not going to read through the evaluation criteria since this information is straight from the RFP, but I did want to note that we've simplified this from a 100-point scale to a 20-point scale and put a little extra weight on the strength and feasibility of the proposal and on the potential impact of the project beyond the 1-year grant period. Next slide. As I said, I'm not going to read through these. They are word for word from the RFP, and I want to make sure we're prioritizing our time for anybody who might have questions. So thanks. Just wanted to get these up there. Next slide. I wanted to say a few words on where proposals often fail to get past the first round. Of the 226 proposals we received last year, a large number were disqualified in the initial review, heavily because of the issues listed here. Our program is focused on innovative strategies and explicitly excludes evaluation of cytology-based screening. So proposals focused on generating demand for or supply of pap smears are ineligible. Grants program funding can cover supplies with one exception. Thanks. Our programs, grants program funding can cover supplies, but we have an exception. We can't use that funding to purchase HPV vaccines. As previously noted, we only fund certified nonprofit organizations, so for-profit actors are ineligible. Also noted previously, we do require each proposal to show proof of other support, basically that Together for Health isn't the sole funder of any project. Finally, we no longer accept proposals or any submitted materials via our email address at info@togetherforhealth.org. All proposals and all documents need to be submitted through the grants portal. In cases where an organization forgets to add some materials, we do ask that the proposal be resubmitted in full before the deadline. Thanks for your patience on this. It's more a matter of making sure we're keeping track of everything and not storing important documents in multiple locations. So we appreciate your patience on this. Next slide. We're going to offer some time for Q&A at the end of this session. So if you do have questions, please do click the Q&A button at the bottom of the Zoom window, and we'll start going through those when we're done. But after 5 years, we have seen a number of the same very similar questions come through. So we thought it might be a good idea to put some of those questions out front for those of you who have taken the time to attend this webinar. One second. Okay, so we get the question a lot asking if I have a pending certification in my country for a nonprofit status. Can I still apply? Unfortunately, we need to see documented proof of nonprofit status by the application deadline. We can't accept a pending submission in part because it won't get through due diligence if an award is made and that isn't there. So groups with pending status who can't provide that before the deadline are ineligible. Organizations can apply under both tracks for a maximum of 2 proposals, 1 under each track. So you can do a demand program as well as a supply program in 2 separate proposals, but you can't do 2 under track 1 or 2 under track 2 or more than 1 under each. Excuse me. There is no minimum of co-funding from external sources, but as I noted in the evaluation criteria, we do score on what we see as the sustainability of the project. There's no cap on indirect costs, but strong proposals will have reasonable budgets and they'll show value for money. We're a small team and we can't provide any, oh, sorry, next slide, thanks. We're a small team and we can't provide any guidance to assist organizations in strengthening their proposals, nor can we provide feedback on proposals that don't get selected. Past awardees are still eligible to apply, but are ineligible to be awarded for 3 straight years. So we've had organizations get funded 2 years in a row, but that's the limit. Finally, the RFP notes that Together membership organizations receive a slight preference in case of a tight evaluation score. When we launch our RFP, we tend to receive a number of inquiries about how to join our network. We're not currently soliciting new members, but we do see facilitating connections between cervical cancer prevention groups as a key part of our mission. We recently launched a LinkedIn discussion group that we'd love to see used as a way to ask questions from the community and to make connections. I think that is it. With that, I guess I'd like to invite my colleagues to chime in if there's anything they'd like to add here or that I didn't cover.
Hi, Tom. Thank you. This is Heather White, Executive Director at Together for Health. I just want to say thanks to everyone for joining and for submitting questions through the Q&A box. We're happy to keep answering questions and to stay on within the hour as long as there are questions to be answered. One note that I wanted to make, because someone just put through a question for us about whether applications can be submitted in other languages. And I just wanted to confirm that submissions do need to be submitted in English. Unfortunately, we don't have the capacity to evaluate proposals in language other than English. So I just wanted to make that clear. And I also wanted to take a moment to recognize and to thank our colleagues at Prevent Cancer Foundation. Tom, you may have already mentioned our external reviewer this year, but we do have a good colleague over from Prevent Cancer Foundation who will be joining us this year on our final phase of our review process.
Thanks, Heather.
Yeah.
Okay, with that, I suppose we can start going through our questions. I see we have some open questions going through, and also thanks to my colleagues for answering questions as I was speaking. Um, I see a question here asking if Yemeni NGOs can be part of this RFP. My understanding off the top of my head is that Yemen is listed as a low or middle income country under World Bank criteria. That said, the grants portal is already programmed to only list countries that meet that criteria. So any country that doesn't show up in the dropdown is essentially ineligible. So thanks for that question. I see another question asking, do organizations need to have specific expertise in cervical cancer? What about organizations that have worked extensively in women's health and cervical cancer has been one small piece, but the organization is interested in expanding in this area? We do require a proven track record in cervical cancer prevention for eligible organizations. The extent of that experience is something we will weigh. So I will say if there is some experience that I think that meets the basic requirement, but we do want to be able to show uh, we do want to be able to uh, get a good sense of what kind of activities any applying organization has undertaken in this area. So thanks for the question. There was a question about the reporting or project follow-up with our organization. We do require Heather, chime in if I getting this wrong, but we do require a mid-year review of documents. So that's usually a short report, report on budget spend down. We also do ask organizations to provide us with some collateral, so either photographs or materials that we can use to promote your project, as well as our grants program. I see another question here asking, can one proposal contain both tracks? This is kind of a sticky one. The portal set up to only allow you to pick one or the other. Also, I was going to say for a $30,000 proposal, I think trying to do both demand and supply at the same time can be a little daunting. Uh,
Tom, could I chime in on that one, please?
Absolutely, go ahead.
Thank you. And let me also say, with respect to the prior question about what are the reporting commitments for any of our grantees, we usually do a quarterly check-in that's rather informal, just to make sure that things are on track. We have had in the past situations in which a program, for whatever reason, is challenged in rolling out, and so we like to connect with grantees on a quarterly basis through a very brief phone call. And then we have reporting requirements at the 6-month mark and at the 12-month mark to show, as Tom mentioned, financial reporting as well as a narrative, which would walk us through what are some of the challenges you've confronted, what are some of your lessons learned, how are you progressing in terms of your expected achievements in reaching target populations and your grant program objectives and so on. But really, we try to make it an easy process for grantees. We know that this is a relatively small award, and we don't want to hold anyone up in terms of programming and reporting requirements or bureaucracy. So we try to make it as easy and convenient for you. And I would also mention, as Tom said, that we definitely like to promote the work that you're doing and the success and the challenges that you're having. And so we do ask for materials from grantees to be able to do that, as well as any information, education, or communication materials that you would be drafting or developing as part of the program. We like to see those just so that we can also share them with other collaborators and weigh in on any of the materials that you're developing. So that's quickly that question, maybe not so quickly, but I just wanted to give a little more detail. And then the next question that someone had asked about the two tracks, I would say that obviously both tracks are going to play into most proposals, meaning if you are offering services, you will have some sort of a demand creation element to your work, and presumably vice versa. But it really comes down to a judgment call based on your program, what you're proposing for us, as to whether you feel like you're a better fit in track one, which is building demand for cervical cancer prevention services, or track two, which is improving supply side access to those services. So it really becomes a judgment call. And um, as Tom mentioned, you have the opportunity to choose one or two tracks, but not both. That's all from me. Thanks.
Thanks, Heather. Uh, Again, I'm going to go through these questions as we receive them, but if we run out of time, my apologies. I want to make sure we're taking doing a good job with everyone's time. I see a question here. Can a not-for-profit lead applicant submit together with a partner to consortium that is a for-profit organization? That is a good question. I don't. I might want to go back and check with the team on this, and we can respond to this question via the list we're going to publish on our website in a few days. I think that it's important that the lead organization is a nonprofit organization, but I need to double check to see if having a for-profit organization in a consortium might complicate eligibility. So. Just to say, I probably should have mentioned this earlier. We are going to post answers to all the questions we receive on our website by the end of this week. So I know we've also gotten plenty via our info@email box. So look forward to those. And any of these that I can't answer here, I'll double check and I'll make sure those answers get posted. So thanks for your patience. I've got a question about references. What do references mean? That's basically supporting documentation. So citations you might want to do if you wanted to cite a specific article or a specific publication that provides some evidence behind the epidemiology or the effectiveness of the strategy in the program. If Ukraine has been classified as an above average country by the World Bank since last year, they cannot participate in this grant competition. I believe that is correct. As I say, only countries listed as low and middle income countries by World Bank criteria are eligible. We had a grant on cervical cancer end in April 2025. We'd like to extend the project. Can we apply? Provided that there's co-funding, I believe the answer is yes, but I can double check on that. I think in that follows with the next question I see here. Proposal without co-funding is not allowed. Again, we want to see sustainability, and we want to make sure that we're not the only organization that has skin in this game, as we say. So yes, lack of co-funding will be seen as a barrier to eligibility.
Tom, could I just chime in on that one as well?
Absolutely.
Thank you. To the question with respect to having a grant on cervical cancer that ended just last month, my interpretation of that would be that if you all show a demonstrated track record of cervical cancer prevention work, and you've just had a grant in, I would encourage you to apply. I think you would meet eligibility criteria. With respect to the co-funding question, it's a good one. And I would say, support, whatever that looks like, could even be in-kind support, meaning if the government has made a serious commitment to this health area and to these services in your country, we're simply trying to stay away from being a relatively small grant mechanism that has a relatively small period of funding that just comes and goes. We need to be able to see that there is an ecosystem around your work that can help support and build on and continue beyond the life cycle of a single project. So that's really the spirit in which we've written that criteria. But if there are other ways that your project is supported that are not, grant funding or dollars coming in the door, then I would say I would welcome you all to submit an application. Over.
Thanks, Heather. Appreciate it. Um, so I noted that Heather already mentioned that we've got our colleagues at the Prevent Cancer Foundation who have offered to assist us in external review. Allison Steinberg of Prevent Cancer Foundation is actually on the webinar now. I was going to ask if she might be willing to help us let us take a little break from the Q&A and say a few words about that, if that's all right. Allison, if you're there, you are on and
Hi,
off mute.
yes. Good morning, everybody. Thanks, Tom. Yes, I am the director of early detection and cancer prevention at the Prevent Cancer Foundation. And we are the only US nonprofit that is focused on early detection and cancer prevention. We focus on education and outreach. We work with communities. We do fund research. So we have multiple grant cycles for all types of research, whether it be translational, clinical trials, population health, or dissemination science. And then we also have a hand in policy and advocacy to make sure that the public is getting what they need as it relates to early detection and prevention. So I'm happy to partner with this grant cycle. And Tom, if you want me to share anything else, I'm happy to do so.
As much as you feel like sharing, we just really appreciate your time, and we thought it would be great for our attendees to get a sense of the kind of groups and the kind of experts we call on to help us out with this.
Yeah, so I mean, my background, I've been in oncology. I'm a clinician for quite some time. I've worked with Johns Hopkins. I've been a director at hospitals. I also teach at a institution, University of Maryland School of Nursing. So I have a kind of a varied background, but very dedicated to oncology research. So happy to be part of this.
Thanks so much. We're so grateful for your contribution on this. It makes it's a big help to us, not only because the workload can be high, but also just to help us bring an extra perspective out from the ones we live in every day. So thank you so much.
Sure.
All right, with that, I was going to go ahead and keep going down the list of questions. I think we'll probably keep going through the questions until about 8:45, sorry, 9:45 Eastern. So we've got about 20 more minutes here. So keep them coming, and we'll do our best to get through as many as we can. So I do see a question here asking from an organization that doesn't have prior experience specifically in cervical cancer. Again, one of our initial screening criteria is organizations that do have some track record in cervical cancer prevention. And if this is a new area for you, it's unlikely that your proposal would probably score very high. Heather, I don't know if you want to say anything on that, but it is one of our initial filters is we want to see organizations that have engaged in this space before.
Yeah, that's right, Tom. I'll just quickly add to thank you for the question. And we recognize and appreciate, the real desire to want to get programs and interventions rolled out in communities, particularly in high burden communities. But the caveat for us is that this is such a small mechanism that we feel like it's very important that programs be able to show that they already have experience and expertise in this area so that they can build upon those experience and that expertise with the use of these funds. Thank you.
Thank you. The next question I see, are United Nations organizations allowed to submit a proposal for this call for proposals? That's a good question. I believe UN organizations do have nonprofit charters, but I also believe we do need to see proof of nonprofit status, and I'm not sure exactly what that looks like for a multilateral agency. Uh, Heather, perhaps you know better than I, but I'm not actually sure on this question. So
Yeah, this is a question that we will have to take to our team and to do some research to confirm. It may be worth noting we are Together for Health is a fiscally sponsored project of a larger nonprofit called Panorama Global, and so a lot of our questions related to um, the functioning of how these grants are supported and how the dollars flow, et cetera, is we have to be compliant with the rules of our fiscal sponsor. So we need to go back and be able to discuss with them and come back with a response, which we will do.
yeah,
Thank you.
we'll put that response on our website. Thanks so much for the question. I see a question. I can apply for track 1 and track 2, two separate proposals from same organization. Absolutely. As I said, every applying organization can submit a maximum of one proposal per track. So thanks for that question. I see a question. We can apply as a non-member. Yes, absolutely. Not this call for proposals is not limited to Together's members. We only have I think 7 membership organizations. Just to say that those organizations, in the case of a tie, an evaluation tie, would get the slight edge over non-members. So, but yeah, absolutely, we get hundreds of proposals, and most of those, the great majority of those are not from members. So thanks for the question. The timing of the grant. So grants are for grants are for 1 year. So as of the initiation of the grant in August, the term of the grant is 1 year to the following August. So hopefully that's clear. There's a question about maximum pages allowable for the proposal. Given the way the new portal's been set up, there's no longer a page count. The proposal, the main content of the proposal will be put into text fields on the grants portal. So I know in past years we had a 5-page proposal, a 5-page limit. We did away with that to try to make this simpler. We think that by limiting the amount of text, we can help organizations not have to write a ton of content to try to fill 5 pages. We want to really get down to the essence of it. So so no worries about page count anymore. Is Pakistan eligible for call for proposal? I believe Pakistan is a lower middle country, so the answer is yes. Can organizations apply in concert with other organizations? I believe the answer to this is yes, provided that they are nonprofits. Otherwise, I can check. I believe we have had coalitions apply in the past.
Yeah, Tom, that's correct. We have had coalitions. The only caveat I would say there is to clearly show who is the lead organization and how the responsibilities and the budget flows across the consortium.
Fantastic. Thank you. I'm seeing a number of questions here asking about specific countries. Again, in the RFP, there should be a link to the World Bank's updated listing of country income levels. So I'm going to pass those questions. If you are asking about a specific country, please go back to the RFP, click on that link, and you should be able to find. But as I said, the portal already omits countries that in its dropdown that aren't from lower middle countries. So if you tried to apply for a country that isn't on that list, you would basically be unable to find your country on that list. So thank you. Sorry, some of these questions I've already answered. There's a question about does this grant application support purchase of HPV vaccines? It does not. We are unable to use this funding for HPV vaccines. Would a project be eligible if it has previously received funding, allowing for some infrastructure building, but has no current funding? I think that question follows on a question Heather answered in more detail before. We would encourage that organization to apply. I think it's more a matter of making sure that these projects are sustainable. There was a question about the total budget available. That's a good one. I'm sorry I didn't put that in there. $30,000 US is our contribution to the project over the course of the year. Given the co-funding requirements, that doesn't mean the $30,000 is the whole budget. We would like to see what portions of the project's budget is coming from another source, but $30,000 US is the max grant from TogetHER's grants program. Thank you. Some of these questions already answered. Bear with me. There were so many good questions. I really appreciate it. Can we apply along with downstream partners? I'm not entirely certain how to answer that question. So the person, Mato, if you would like to maybe resubmit that question, if I can get to it, I'm not really sure what that means. Oh, I'm sorry, not different. Bear with me.
Tom, if just to quickly respond to that specific question, if the question is regarding whether you can submit again as a consortium with subgrantees, the answer is yes, but you'll just need to very clearly demonstrate how the responsibilities are allocated as well as how the budgets are allocated across partners.
Thank you. One second. Thank you all. Again, there's the questions are coming fast and furious, so we're doing our best. Slides will be shared with these. We're going to post this webinar with the slides on our website along with all the answers. So appreciate that a lot of people want to be able to share this. Also, we had a lot of there's a lot of interest here, so we want to make sure that this is a resource for people to use. There was a question about whether or not organizations can receive feedback if they're not successful. Again, as I said before, we cannot. We just don't. Our team is very small, and we just don't have the capacity to provide that kind of feedback. So apologies in advance. If we could, we would, but it's just not something we can offer. Question from apart from HPV vaccines, can funds be used for purchase of equipment for screening and treatment? The answer is yes, provided that the screening method is not cytology. We are focused on new and innovative solutions and have explicitly excluded established methods like Pap smears from our grants program. Can we support government running programs or hospitals working on cancer and supporting cancer survivors? Now, this is Together for Health is focused on cervical cancer prevention. We are proud to partner with survivors and survivor organizations, but our grants program is fairly dedicated to prevention in this case. So if that answers the second part of that question. As far as support government running programs or hospitals, that's a good question. We're still talking to our fiscal sponsor to determine if we need to make any special exceptions here. But regardless, we do need, if a government supports a hospital, if the hospital is a nonprofit, standalone nonprofit organization, I believe we should be able to fund those organizations. But again, we're talking to our fiscal sponsor, and I should be able to provide a little bit better guidance on our website this week. I see there's a question about an error message received in the grants portal. Sorry, it's scrolling down on me here. One second. I do not know that we have any kind of file that any limitations, the kind of files that can be uploaded. If anyone is having a problem, I see from a Samantha here. Samantha, if you do want to send me a screenshot of that error message you're receiving, please do send that to info@togetherforhealth.org, and I will do my best to troubleshoot. Can a U.S. academic institution submit a proposal for a project based in Kenya? I believe the answer is yes. Heather, I don't think we have any I think we've definitely had universities submit prior.
Yeah, universities have submitted in the past. They'll they'll just have to show their charter as their proof of nonprofit or charitable status. But we're happy to accept applications from universities. Just quickly to maybe give a little more background and context around our eligibility criteria. We're really, when we launched the grants program several years ago, one of the interests that we had was to ensure that organizations that are community-based organizations, academics, nonprofits of all types have an opportunity to expand and to build upon their programs or even their research questions, et cetera. So we're really just simply trying to keep a firewall, if that's the right word, for companies that may be looking to try to build or engineer new products or services. That's the type of project that we're looking to sideline in the grants program. So that's why we cast the line between for profit and not for profit very clearly. Thank you.
Thank you, Heather. What examples do you need to show if a program's cervical cancer is credible? It's a good question. I think it might also lean a little bit in the direction of trying to provide feedback ahead of time. I guess I don't think I really have a good answer for that question, but we just need to, organizations that or proposals that will score highly will be able to show a demonstrated track record. I don't think we have any specifics on what that looks like.
Can
Heather
I
already
just
asked that.
jump in on that one too?
Absolutely,
Sorry.
absolutely.
I'm sorry. I just want to give as much clarity as I can. You know, in terms of a demonstrated track record, really what we're looking for are what are program achievements around cervical cancer prevention? What has your organization been able to do in the past? Who are the members of your consortium or of your application? So you'll have an opportunity to talk about the expertise and experience of your team members. I mean, that certainly counts as building credibility. And in some cases, we see, for example, letters of support being written by host country governments or by other consortium members who are also working in that community. So those kinds of things would be the things we would be looking for in terms of demonstrating credibility. Thank you.
Thanks. Are there preferred geographic regions or target populations within country for funding prioritization? There are not. As I've noted before, we've provided grants for any low or middle income country, regardless of geographic region. Can we clarify expectations for partnerships with local health authorities or ministries of health? That is a tough question. I'm not entirely sure I understand what that means, but we do want organizations that do have strong partnerships with local authorities or ministries of health, and that can demonstrate that will probably have a bit of an edge, I suppose. But I don't know there's no specific expectation on those. Heather, I don't know if you want to add on that. I just don't really know that we don't have any it's not a requirement, but it is a way in which an organization would show that they are active in this area and have a sustainable ecosystem around them to work. Is there flexibility in modifying activities after the proposal if implementation challenges arise? This has happened before. I would say to the extent possible, we do want to keep these focused on what the original proposal is. It's only a 1-year project, but we do know that things happen. So Heather, I don't know if we want to say anything about modifying activities. As we said, we try to do quarterly check-ins with our grantees to see how things are going and to see if there is a need for any changes. So I think to the extent that changes need to be made, those are allowable, provided that we have a discussion.
Yeah, that's fine. I would just also say, our we really look to you all as being experts in your respective communities around any changes that need to be made. Of course, if you feel like one of your main, specific aims or objectives are being fundamentally changed, of course, that's something that you would want to communicate with us, as well as if you've got an IRB, obviously you would be communicating with them. But we do recognize that there are constraints, and sometimes those are outside of your control. So we just would ask that you would be good stewards like any program and keep us in communication around any adjustments that you make.
Thank you. I have a question here asking if if the application form on the portal can be previewed. All of the required information for the portal is in the RFP, along with and the other question is, will character counts include spaces? It's actually based on word count, not character count. So those are clearly outlined in the RFP. There was a note in the RFP that we do recommend that organizations who are submitting put their info, basically pre-create their text for the fields in a separate document, then cut and paste in case there's any hiccups in the process. But yeah, thanks for that question. I think we've got time for a few more. There is an option in the portal for submitting appendices. There's a any related documents submission section at the end. So if you have other documents besides the required budget and work plan and certificates, absolutely you can add those in. For the demand-side interventions, do we need to ensure that we cover all the three barriers of HPV vaccines, cervical cancer screening, and pre-cancer treatment, or can we just choose one or two? We do not prescribe which prevention modality your project focuses on. It could be one, it could be all three. So I guess that's really up to you. I'll do one more question, and I think we will be probably about ready to wrap up. Does the proposal or application need to have been submitted to an IRB as part of a study? I don't believe the answer is no, Heather. I don't think that's
Yeah,
that's
I'd quickly just say with respect to any research questions that you may be trying to answer through this grants program, we would defer to your local IRB and their the guidance and criteria for submissions to IRB locally, where you are. It's certainly not a criteria of the project per se, but if you are conducting research on human subjects and you would be otherwise expected to have IRB approvals, then we would expect you to have to solicit IRB approvals in this case as well.
great. So I know we still have a number of open questions still. I do see that there's some questions that are duplicative. We are going to endeavor to go through these and try to answer as many of these as possible, or at least try to sum up similar questions when we post answers to all the questions later this week. So thanks again to so many of you for attending our webinar. We are going to make these slides and this recording available. And to that end, I think I would just like to say thanks to all for attending the webinar, and we are very much looking forward to seeing your proposals. So with that, thanks again and have a great day.
Thanks, everyone.